Jay Termal from CBC. I'll read you a bit of a tweet here. Well, it's regarding the testing. I think we're down to about 6,000 people per day. The numbers are going down. The number of infections are going down, of course, because it seems like we're testing fewer people, almost like the Donald Trump pattern of the fewer we test, the fewer positive results we'll have. This tweet here: I woke up with a fever, cough, chest pain, and sore throat. However, I'm not eligible to be tested for COVID-19. I was just told to self-isolate. I think there's some confusion for Quebecers. They're wondering who can get tested, where can they get tested. This person says he was told that because he wasn't in contact with anyone that had COVID-19 symptoms, he was told he couldn't get tested. What's the truth here?
That's a problem. Thank you for this information. I would like to know where it happens because I want to correct. It's clear that even asymptomatic people who want to get tested must be tested. Actually, there is even clinics waiting for patients and they are not coming. So if you want to be tested, no problem. If you have symptoms, it's clear you must be tested. I will make sure that this information in my premier and my minister told us that they are not happy with the rate of testing we're doing in Quebec. We are launching a new strategy with asymptomatics that will prepare us to have a big capacity of testing when cases are going to come back, and perhaps my minister wants to add on this.
Well, I think it's clear that it's roughly 6,000 per day. This is not enough, and there are many reasons for that, and probably the middle of the summer explain part of it, and people that have a sense of confidence, but it's a false sense of confidence. We should not base on that to make sure that everybody that wants to be tested should be tested first. What we've asked Dr. Arruda with my deputy ministers to make sure that we have a plan, because we are not testing enough. And we are not testing. We will look into the next few days as to how we can look into certain region. And I take the example of what's happening in the bars, for example, in the Laurentides. What should we do with those regions? What should we do on the Grande Allée in Quebec City? I think we have to look by region. We have to look also at the border, because we know that this is going to be an issue during the summer between the States and Quebec. And so we need to look at how we can increase the number of tests and not waiting for September. So what we've discussed in the last few days is really to go for a plan to go back to our objective by the end of this month. So there is really a clear path of action to go there.